To fully appreciate testosterone's effect on mental performance, one must be familiar with its function. The fact that it impacts regions of the brain that are involved in memory, attention, and problem solving shows that its significance extends beyond mere physical well-being. Outside of the physical sphere, testosterone has a profound impact. A key component of mental acuity, it aids in maintaining mental clarity and concentration. It does things that stimulate the mind and infiltrate the brain in ways that are subtle but significant. May facilitate the use of testosterone's advantages in fostering cognitive resilience. Like a conductor directing the complex symphony in our heads, it helps us concentrate. Testosterone helps synchronize different mental processes, much as a conductor makes sure all the instruments are playing in unison. Suboptimal testosterone levels may throw the balance out of whack, causing observable shifts in brain function. This might show as memory lapses, difficulty focusing, or even mood swings, underlining the hormone's vital role in sustaining mental wellness. The brain, a complex network of billions of neurons, depends on communication. A complex network of interconnected neurons controls human perception, emotion, and behavior via a delicate symphony of electrical impulses. This dense network of connections is what helps us to absorb information, learn new things, and adapt to our surroundings. Testosterone plays a significant brain areas important for cognitive function. It changes the way neurons communicate, improving the effectiveness of these connections. This hormone is not only about physical features, it significantly influences our brain processes. These areas, particularly the hippocampus and prefrontal cortex, are crucial for memory consolidation. Attention and decision-making, the hippocampus is necessary for establishing new memories and linking them to emotions, while the prefrontal cortex is the command center for planning, thinking, and problem solving. Imagine testosterone as a key unlocking certain brain regions' potential by attaching to its receptors. It stimulates circuits that boost cognitive capacities, making us more alert, focused, and capable of complicated cognition. It improves neural signaling, facilitating the flow of information. This greater connection between neurons assists in speedier decision-making, better memory retention, and overall sharper cognitive functioning. This delicate balance between hormone and brain cell supports our capacity to think, remember, and make informed choices. The balance of testosterone is vital for keeping these cognitive functioning at their best. When testosterone levels fall, this delicate equilibrium is broken, possibly impairing cognitive functioning. Reduced levels may contribute to poorer information processing, memory lapses, and difficulty in focus, underscoring the need of maintaining hormonal balance for good brain health. Memory, that elusive skill, depends largely on testosterone's impact. Studies reveal that even low testosterone shortage might impair memory recall and spatial navigation. Men suffering age-related testosterone reduction typically experience greater forgetfulness and difficulties remembering names or information. This reduction may be connected to testosterone's function in neurogenesis, the formation of new brain cells. The hippocampus, a crucial memory area, depends on this mechanism for optimum operation. Testosterone seems to enhance neurogenesis, increasing the brain's ability to develop and store memories. When testosterone levels fall, this mechanism may be impaired, causing to memory lapses. Attention, the capacity to concentrate on a given activity among distractions, is vital for cognitive function. Research reveals a relationship between testosterone levels and attentional control. Men with greater testosterone levels tend to demonstrate better sustained focus and lower impulsivity. Testosterone's impact on the prefrontal cortex, the brain's executive center, presumably plays a part in this improved attention. This area functions as a conductor, screening distractions and focusing crucial information. Optimal testosterone levels may boost the prefrontal cortex's efficiency, increasing our capacity to focus and avoid distractions. Executive function, a spectrum of higher order cognitive functions, covers planning, decision-making, and problem solving. These abilities are vital for handling difficult activities and making educated decisions in our everyday lives. These talents depend primarily on the prefrontal cortex, a brain area especially susceptible to testosterone's impact. The prefrontal cortex is responsible for processing information, regulating impulses, and managing our thoughts and behaviors. Studies suggest that males with greater testosterone levels tend to do better on tests testing executive function. This shows a relationship between testosterone levels and cognitive function, especially in areas requiring strategic thinking and problem solving. Testosterone's effect in executive function may arise from its influence on dopamine signaling in the prefrontal cortex. Dopamine pathways are critical for sending signals that impact motivation, reward, and cognitive control. Dopamine, a neurotransmitter linked with desire and reward, plays a critical function in executive control. It helps manage our capacity to concentrate, plan, and execute activities effectively. Testosterone seems to influence dopamine release, potentially boosting our capacity to plan, strategize, and make informed judgments. By regulating dopamine levels, testosterone may enhance our cognitive skills, making us more effective at managing difficult circumstances and attaining our objectives. The effect of low testosterone goes beyond the field of cognition. Physical changes typically follow cognitive deterioration, presenting a fuller picture of the hormone's effect. Reduced muscular mass, increased tiredness, and poor libido might signify a possible imbalance. These bodily manifestations underline the interdependence of mind and body. Testosterone's effect pervades both the significance of treating hormonal abnormalities holistically. Recognizing these bodily signs may give vital insights into an individual's overall well-being. Identifying low testosterone frequently includes identifying a constellation of symptoms. Cognitive changes, such as trouble focusing, memory lapses, and impaired mental sharpness, might be early symptoms. These cognitive alterations may be followed by emotional variations such as increased irritation or depressed mood. Physical symptoms frequently entangle with these cognitive and emotional changes. Reduced muscular mass, increased body fat, and poor energy levels might further reveal an underlying hormonal imbalance. Recognizing this tapestry of symptoms is vital for obtaining prompt medical attention. Diagnosing low testosterone takes a multifaceted approach. A detailed medical history, including any drugs or underlying health issues, is vital. Physical examination. Assessing for indications like decreasing muscle mass or body hair gives extra information. Blood tests, monitoring testosterone levels at specified periods, confirm the diagnosis. These tests assist identify whether testosterone levels fall below the usual range for an individual's age and health state. Accurate diagnosis is crucial for devising an effective treatment approach. Treating low testosterone frequently includes testosterone replacement therapy, or TRT. This treatment tries to restore testosterone levels to a healthy range, reducing symptoms and enhancing quality of life. TRT may be provided by many techniques, including injections, gels, or patches. The choice of TRT technique varies on individual requirements, preferences, and medical history. Regular monitoring of testosterone levels is necessary throughout therapy to guarantee effectiveness and prevent any negative effects. TRT, when carefully given and managed, may dramatically enhance both physical and cognitive well-being. While medicinal therapies like TRT play a key role, lifestyle adjustments may complement therapy and enhance general well-being. Regular physical exercise, especially strength training, may naturally enhance testosterone levels and improve cognitive performance. A balanced diet rich in fruits, vegetables, and lean protein supplies critical nutrients for hormone synthesis and brain function. Prioritizing adequate sleep, regulating stress levels, and keeping a healthy weight will further enhance testosterone levels and boost cognitive vigor. The complicated link between testosterone and cognitive function is an ongoing topic of scientific investigation. Researchers are looking further into the processes by which testosterone affects the brain, aiming to uncover its multiple activities. Future study intends to create more tailored and individualized techniques to addressing low testosterone, maximizing both cognitive and physical health. As our study of this complicated hormone grows, we may anticipate to find much more about its significant effect on the human mind and body.
Looking for high-quality supplements backed by Dr. Andrew Huberman himself? Check out the links in the description below and subscribe and hit the bell icon if you've learned anything new or anything of value.